In a decision that was accidentally leaked yesterday. Today, the Supreme Court officially ruled to dismiss an appeal from Idaho officials on whether the state's strict abortion law conflicts with federal law.
So this means emergency abortions will be legal in Idaho for now. Most experts we have spoken to today agree they would not be surprised, though, if the Supreme Court ends up having to weigh in on similar cases down the road.
It just said this case is going back up to the district court. We shouldn't have taken it up. We did that prematurely, and they're going to let the lower courts figure out, decide the merits, and then it'll likely come back to them later.
Thursday's decision brings some encouragement for Idaho healthcare providers, though they are not also celebrating just yet.
So KREM 2's Shannon Mowdy spoke with some of them about how this ruling impacts patients and providers. Shannon?
Any feelings of optimism among Idaho doctors is tempered for now, with uncertainty around a final legal decision on when they can provide abortions. Many still want more clarity on Idaho's law. The High Court's decision in this matter is final, but the legal battle over emergency abortions in Idaho isn't. Idaho's pro-life lawmakers marked the moment a small victory.
Today, the court said that Idaho will be able to enforce its law to save lives in the vast majority of circumstances while the case proceeds.
As did pro-choice advocates and some healthcare professionals. The SCOTUS decision allows emergency abortions to protect the health of the pregnant person. For now, a bit of breathing room.
Physicians are going to feel confident that they can make the recommendations to their patients,
says St. Luke's attorney Peg Doherty,
knowing that that follow-up sentence is not going to be, but we will have to look to transfer you.
But confusion continues.
There is a pro-abortion agenda that is trying to confuse doctors and make them scared of what our law says when our law is really clear.
Idaho Attorney General Raul Labrador says he's been meeting with physicians to clear up fear of prosecution. But some physicians say those fears come directly from ambiguities in Idaho's law.
What our physicians and our patients are very concerned about are those situations in which a pregnant woman's health is in jeopardy, that she is on a track to lose her fertility or a major bodily function. And that is not clear in the law.
And that's where the potential fear as a clinician exists of criminal prosecution or losing the medical license.
It's also unclear if Thursday's ruling will be enough to stop the bleed. Keller says Idaho has lost 22% of its OBGYNs since the law went into effect.
2 of my colleagues left simply because of the change in the trigger ban prior to this day. Another colleague left.
As the legal battle rages on with no end date in sight. Now, as they await a legal decision, some in Idaho's medical community say they want Idaho's legislature to give much needed clarity by adding a maternal health exemption in the abortion ban. Shannon Mowdy, KREM 2 News.